Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, we present the first of a two-part series on the health of migrants at the U.S. Mexico border. Stephanie Desmon talks with Dr. Janine Young, a pediatrician at the University of California, San Diego, and an expert on immigrant and refugee health. They discuss what happens when people, including young children, arrive severely injured, dehydrated, and malnourished, and traumatized. Let's listen.
Janine Young, thanks so much for joining me.
Absolutely. Happy to be here.
I wanted to talk to you today about the healthcare situation for the migrants crossing into California from the southern border of the United States. I know that there are a lot more migrants than expected, and they need to be sheltered, and they need to be fed, and they need to get healthcare, but that hasn't always been the case.
That is true. What's happening currently, and what we've seen happen over the past year, and it evolves all the time, is that back in September of 2023 and before that, there were more and more arrivals coming into the U.S. And, at the California southern border, Customs and Border Protection has detention centers, but when they're filled, there's nowhere else for these migrants to go. And so they are still, as I'm speaking today, left out in an unprotected detention site. Children are, as of a week and a half ago, because of Judge G's federal ruling allowing them to be processed quickly, are being brought into CBP sites, but adults are still being left out for up to weeks at a time on the U.S. side of the border, told not to leave. And it's been left up to volunteers in the communities to provide them with shelter, fresh water, medical triage, medications, housing, meaning tents or tarps, and often quite cold weather. And we've seen lots of injuries, lots of falls from the border wall, which has been increased in height to 30 feet, and then medical issues not addressed and left for volunteers to identify and call 911.
That seems pretty dangerous. Just to clarify for our listeners, CBP is Customs and Border Protection. So what's happening to people as they wait?
So up until 2 weeks ago, unaccompanied children were also left out. And this has been months and months of them being left out on their own, where they're at the mercy of the other family units or individual adults who are there to help them, which also, and this is on the U.S. side of the border, increasing their risk significantly for trafficking, for injury, and other, significant morbidity. So we've seen with the ruling, at least, what is supposed to be happening is the CBP, as soon as they apprehend these kids, whether they're in families or alone, they're supposed to be prioritized and brought immediately to a CBP site to get more triaging done. It remains to be seen how effective that is and how quickly that is going to happen. For adults, they're still left out, and they're left waiting until there's space to bring them into the CBP shelters. So we visited the San Ysidro border and Jacumba, which is about an hour and a half east of San Diego, and there are these ad hoc tent camps that have been put up by volunteers making peanut butter and jelly sandwiches, and I'm not kidding, and providing charging stations for people's phones so they can communicate back with loved ones, et cetera. There have been reports of deaths. There was a report of a 13-year-old dying after being brought over to the U.S. side of the border after a car crash. On the Mexican side, there have been, multiple fractures, head trauma from climbing the wall, as I said before.
So in these tent camps, there's no healthcare. When they get to the custody of CBP, are people being evaluated quickly, or are there other issues involved?
I think that's a great question. So I think, honestly, as soon as CBP apprehends immigrant children or adult, I'm a pediatrician, but this is just an issue in general. There needs to be trained medical providers out at the border. So emergency medical technicians, anyone who's got training and specific training, frankly, and also identifying young children and infants who are in distress. Because what's happening right now is, and this is before, again, they get into CBP custody, is that they're relying on non-trained officers, gun-carrying officers for CBP to triage patients, people who've made these journeys, days and days, dehydration, injury, falls, gone through the Darien Gap, assault victims, pregnant women, infants. So you get the drift here. And so none of that is set up. Once they are brought into CBP custody, they're supposed to be triaged within a certain time period. I'm not there in the CBP sites. There's supposed to be an emergency medical technician triaging. Again, from a pediatric standpoint, a lot of these folks don't have pediatric specific training. I think it's really difficult to identify infants in distress who are covered, who might be breathing very fast. Again, there have been deaths reported in CBP custody because of the lack of training of some of the people who are on the front lines doing this work. When they're overwhelmed with numbers of patients or people, arrivals, there are mid-level providers, nurse practitioners, and physician's assistants who are supposed to be doing these evaluations. But again, it's quite unclear whether they're pediatric trained. And so from that standpoint, I think there's room for missing a lot of illness and more subtleties around disease and disease presentation.
This sounds like a pretty dangerous situation. Health-wise, I'm wondering why this has been allowed to happen. Is it just that they're overwhelmed by the numbers?
This is federal immigration policy that has not been addressed appropriately, that has not been funded appropriately. And this is not going to go away by building walls, because people who are desperate and desperation for, fleeing war, persecution, abject poverty, climate change is not going to go away. And so given all of those things, putting 30, 50-foot walls through our entire borders, people are going to climb and get injured and come into the U.S. anyway. And so it needs to be addressed, and it can't be putting up a 1,000-foot wall. It's just people are going to get through, and we need to come up with a policy to allow people to get to the U.S. and immigrate in a safe way.
From what you've seen, what recommendations do you have to make this situation a little more tenable?
I think and as we've seen so many times before, there's siloing of everything. There's very little communication between agencies, between hospital systems and those federal agencies, and therefore no real partnership. And so what I see is, a sick child goes to CBP, their parent is in detention, the child is brought by themselves to the hospital and is alone while the parent or non-legal guardian are still in detention. There's no communication or systematic communication for coordinating this and providing supportive care and care that is not going to traumatize the child more. And there needs to be much more coordination and funding, frankly, to allow for partnership and collaboration between the hospital systems, medical providers, social workers, and the CBP and Office of Refugee Resettlement.
So clearly this is a political issue, that's the understatement of the year, probably. But is there a will to try to fix this? Or is there just, again, sort of repeating what you just said, hope that it'll go away?
Yeah, I think people can ignore and not see and not look to a certain point, right? And so if you don't talk about it and it's not in the news, then it doesn't exist. I think people are becoming more aware of it because of the sheer numbers who are coming. It is a political issue. I wish it weren't. I think, there needs to be a complete overhaul of how we are allowing people to come into the country and to allow them to do it safely. So right now, asylum seekers, there's no visa. You can't apply in the vast majority of cases to get asylum in the United States from your country or from a secondary country. You have to actually physically make it to the border. And because of that, it's creating these very dangerous situations for everybody, including very, very young children, and very young children who then lose their parents on the way.
So it sounds to me that if you're treating children this way when they're young, that it could really set them up for long-term health problems.
Correct. Yeah. Toxic stress is known. I'd say our policies are causing toxic stress for immigrant children by too generous being probably the wrong word, but application of TVPA, the Trafficking Victims Protection Act, separating grandparents from unaccompanied children because they're not legal guardians. You don't separate children from a trusted adult. And toxic stress, we know, is associated with poor health outcomes long term. So I think our policies are directly impacting the health of children.
What would you like to see going forward?
World peace? It's hard. I mean, it's not hard. Adequate funding to address this, but there needs to be a coming together of leaders in our country in a nonpartisan way to talk about how we can do better for our country by providing more workers that we need, and at the same time doing it in an ethical way that includes people who are fleeing countries where their lives are at risk. What I've heard some people say is, these people are just coming because they just want, to make more money. No one is making a decision to bring their family here, flying from one country to get into another, saving up all their savings, and then walking up from southern Brazil all the way to the southern border with the risks of assault, sexual assault, trafficking, death, extortion, without real reason.
And we're not really taking care of these folks when they get here.
Correct.
Janine Young, thanks so much for joining me.
You're welcome.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ceciri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.